The UAE Ministry of Health has announced a new pricing system of medicines in the UAE. The new system will standardise the pricing of imported medicines to the private sector to ensure reasonable prices for the consumer. The aim is to stabilise the market and encourage investments in the country's pharmaceutical sector. The new system is projected to result in price reduction for over 6,000 medicines. A forum was held on June the 5th to officially announce the new system, which started the following day. The forum served as a platform for key stakeholders to share best practices and expertise and come up with comprehensive recommendations to further improve the UAE's health industry.
First of all, the Ministry of Health were so keen to do the study at the level of the Emirates to find out what's the status of the prices for different type of medicines, especially the medicines for the chronic disease at the level of the country. And we did a study among 5 countries, which it was Lebanon, Bahrain, Oman, Saudi Arabia and Jordan, and we found that the prices of different type of medication, especially for the medicines for the chronic disease, is much more higher than the other countries. At the same time, there was a ministerial decree signed by all the ministers of health at the level of the GCC countries that the price of the drugs should be done through the US dollar to unify the currency. And to implement the dollarization, we found that 44% was the increment of the price of the medicines will occur at the level of the country. And therefore we were so keen to communicate with the pharmaceutical industries and mainly the international pharmaceutical companies, which they are based here at the Emirates. And we have to say that we are so proud that above 90% of those pharmaceutical companies that are based here in the Emirates, and they have their regional office for MENA region here at the Emirates. We got a great support from them, and we were able not only not to allow the increment in the price of the medicine in the country after the dollarization, but we were able to reduce the price of the medicines. And out of 7,053 products registered at the Emirates with different type of medicines, we succeeded to have a reduction in prices from 1 to 40%. For almost 6,632 products. At the end of the day, this is a great support for the poor and needy patients whom they are in need of those medicines, and to provide them the medicines with the lowest price possible. I have to announce something that it has not been announced before, that during the GCC meeting for the pharmaceutical practice, we have members from each single Gulf countries. We found that with comparing the prices of the medicines between all the GCC countries, after this new initiative, the 60% of the medicines priced in the Emirates are the lowest among the GCC countries, and this is a good sign and very good indication. Although the economic of the Emirates are much more stronger, and the lifestyle, the running costs of the Emirates are much more higher than the other GCC countries. Despite that, our 60% of the medicines, their prices are much lower than the GCC countries after the implementation of this new initiative.
The pharmaceutical industry finds this an excellent initiative. What is most important is that we all work together to ensure that patients and residents in the UAE always get the best medications at affordable prices. And for that reason, we collaborated with the Ministry of Health initiative in order to arrive at a reasonable pricing system for medicines in the UAE. The most important is the patient. And as long as patients can get affordable medicines, that is the most important thing. For pharmaceutical manufacturers, for pharmacies, for distributors, maybe there were some concessions here and there, but at the end of the day, what is important is that we have reasonable prices and patients can access medicines.
In nutrition news, Ice cream company Ben & Jerry's announced the removal of genetically modified organisms, or GMOs, from its ice cream. As of now, only 80% of Ben & Jerry's ingredients are sourced non-GMO, but by the end of the year, the company aims to completely phase out genetically modified products from its ice cream. The Vermont-based ice cream maker said the undertaking will be complex because a single flavour can contain up to 40 ingredients. Genetically modified foods, which are engineered to resist insecticides and herbicides, have been a source of controversy in the US and abroad. Supporters say the plants boost crop yields, increasing the global food supply, while critics argue the chemicals can be harmful to the environment and lead to serious health problems. Ben & Jerry's announcement comes less than a year after California residents voted down Proposition 37, a California ballot initiative that would have required genetically modified food to be labelled as such. According to Underground Health, Ben & Jerry's parent company, Unilever, donated almost $500,000 to defeat the measure. If you want to increase your intake of antioxidants, food activist and author Joe Robinson recommends eating wild fruits and vegetables. People are used to eating the sweeter varieties of fruits and veggies, but according to Robinson, most domestic plants have fewer phytonutrients than the wild varieties. Phytonutrients are the compounds that can help reduce the risk of diabetes, heart disease, obesity and cancer. Robinson explained that phytonutrients have antioxidant properties that curb the inflammation at the root of many diseases. The author added that although wild plants may be less sweet and sometimes bitter, they contain 20 or 30 phytonutrients for a really strong health-enhancing effect. Robinson also recommends that consumers get educated about which foods are high in phytonutrients so they can add them into their diets. Examples of fruits and vegetables that are high in phytonutrients are peaches with white flesh, green Granny Smith apples, scallions and fresh herbs. In MMA news, UFC middleweight contender Michael Bisping underwent emergency eye surgery last week. The surgery was performed to repair a detached retina. Bisping complained of blurry vision prior to his UFC 159 fight against Alan Belcher, and ultimately lost all peripheral vision in his right eye before visiting an ophthalmologist. Bisping underwent eye surgery a day after receiving a cortisone epidural in his spine to repair lingering neck issues. The operation was deemed a success, and Bisping is already targeting potential matchups in the UFC middleweight division. Bisping remains uninterested in a bout against former Strikeforce champion Luke Rockhold, because Bisping believes he isn't high enough yet on the division's ladder. Bisping is, however, interested in a match against Kung Lee, who scored a massive upset knockout of Rich Franklin in late 2012. If the Kung Lee fight doesn't push through, Bisping would also be interested in meeting either Yushin Okami or Costa Philippou. Former UFC champion BJ Penn is not ready to retire, despite the urging of UFC president Dana White. According to White, Penn is too tough for his own good, and although BJ might not get knocked out, the shots would knock out a normal fighter. White added that BJ has taken a lot of damage and he doesn't want him to take any more. The Hawaiian fighter has remained quiet since suffering a lopsided 3-round beatdown from Canadian sensation Rory McDonald at UFC on Fox 5 in December 2012. This was his 4th defeat in 6 fights. The 34-year-old has not registered a victory since a 21-second knockout of Matt Hughes in November 2010. Additionally, he has not competed in the lightweight division since coming out on the losing end of a 2-fight championship series with Frankie Edgar. However, Penn is now training and looking to come back to the octagon at 155 pounds. In celebrity news, Hollywood star Angelina Jolie made her first public appearance last week since her preventative double mastectomy. Jolie revealed that she carries a mutation of the BRCA1 gene, which sharply increases her risk of developing both breast and ovarian cancer. The Academy Award-winning actress joined her husband, actor Brad Pitt, during the premiere of his latest film, World War Z, in London. Jolie's arrival drew loud cheers from the crowd. She posed for photos in a floor-length Yves Saint Laurent gown and was all smiles on the red carpet. Pitt called his wife's act heroic and said it was a relief to know that her risk of having cancer is now very low. The mother of 6 is reportedly planning to have her ovaries removed to avoid the risk. TV star Sofia Vergara has also opened up about her battle with cancer. The comedian revealed she had thyroid cancer in 2000, and this left her without a thyroid. The experience inspired Vergara to become an advocate for hypothyroidism awareness. Vergara is now the face of the Follow the Script campaign, which aims to educate individuals with hypothyroidism about the importance of following prescribed treatment. Vergara also said that following her cancer diagnosis, she began to make changes in her life to take better care of her body and to be healthier. She was brought more down to earth and now takes a pill every day to manage her thyroid hormones. Again, the headlines today. Dubai Health Authority to offer free heart surgeries to children outside the UAE. Weight loss surgeries can help control diabetes. The UAE Ministry of Health implements a new pricing system for medicines. Wild fruits and vegetables provide more phytonutrients. Former UFC champion BJ Penn is not ready to retire just yet. And Angelina Jolie makes her first public appearance after her double mastectomy. That's all for this episode. To learn more about any of our news stories, simply visit our website or email us. You can also follow us on our social media accounts and post your comments on our page. This is Rachel Pather. Goodbye and thank you for tuning in.